morning. Thank you very much for joining us. My name is Ernest Timino. Now, following measures for enhanced contact tracing and testing, Ghana has detected an increased number of confirmed COVID-19 cases. As at 6th April 2020, that's 23:30 hours, a total of 287 cases of COVID-19 with 5 deaths have been recorded. The regional distribution of the cases as follows. Greater Accra region has the most cases, that's 256, followed by the Ashanti region 18, Northern region has 10, the Upper West region has 1, Eastern region 1, and Upper East region also 1. A total of 172 cases were reported from routine and enhanced surveillance activities, and those from travelers under mandatory quarantine in both Accra and Tamale are 115. The period for mandatory quarantine for travelers who arrived, that's 21st to 22nd of March 2020, has ended. Now, in all, a total of 1,030 travelers were quarantined during the period. Out of these, 79, representing 7.7%, were positive during the initial testing, whilst 951 were negative. 26 amongst those that were initially negative were found to have converted to be positive the exit screening, bringing to a total of 105, which constitutes 10.2% among the travelers that were quarantined. Now, meanwhile, some stakeholders are calling for a nationwide lockdown to contain the spread of COVID-19. On PM Express Monday evening, special clinician in charge of clinical infectious diseases and assistant professor of medicine called for government to intensify the lockdown to protect the citizenry. Dr. Bertha Sewa spoke on PM Express with Aisha Ibrahim.
If you were to evaluate how effective even a focused lockdown is, you just have to look at Hubei province, which had 80% of China's cases, and China had 99% of the disease. You know, for most of January, we're just watching China. Italy was watching China, France, everyone, just watching to see what would happen. And on January 23rd, the Chinese government undertook a lockdown of Hubei province, and that is why, unless a government chose to go and evacuate people, you couldn't move or do anything. And we're seeing the results. 9 weeks into their lockdown, they have decreased cases. It's not like there's been complete stopping of their transmission. There's still transmission, but it's much, much less. And today, China is exporting PPEs and their economy is getting back. The point is that the lockdown, and the first speaker was right, in that the lockdown buys you time. It's not everything, but I think it needs to be handled with a sense of urgency. I always give this example. If a fire is burning a house, and then you're saying that you want to wait and see because it's only in one room, you want to let it consume the whole house before you get the fire trucks there, you would be making a mistake, unless you don't understand what a fire does. But if you've seen 2, 3, 4, 5 houses, the neighborhood burned down, you move with a certain level of speed. I mean, starting from China, look, the world should not have a pandemic right now.
And you heard Dr. Bertha Sewa, but virologist Dr. Michael also says the sectoral approach to the lockdown is appropriate and in conformity with the WHO standards.
What we are doing is in line with recommendations by WHO. We are still in the process of achieving our objectives, and which will enable us to make clear decisions as to what to do. So let me recall a bit what the WHO said. So the statement they made is that it is not enough to call for a lockdown, but then a lockdown in itself does not extinguish an outbreak or the virus groups, but it must be accompanied by 6 key actions. The first is that you should use it as an opportunity to expand, to train, deploy your healthcare and public health workforce. The second thing is that it must enable you to implement a system to find every suspected case at the community level. The third is that you should use that opportunity to ramp up productive capacity and make available testing for majority of people within the lockdown period. And then you should also use it to equip facilities, identify and then adapt what you need to treat and manage your patients. Last one is that you must develop a clear plan and process to quarantine the contacts. So if you look at what is happening, we have data so far of where all the positive cases came. We have data of the contact of all these positive cases. We know the people who came to the country, I think about a month before the mandatory quarantine. So it's moving to these areas, searching for these first line contact, second line contact, testing them at certain radius, certain diameters from other neighborhoods, will give you an understanding of the true burden of cases, which will inform you as to the next action to take. And for me, I think that the data that we'll get after this period or after this week will enable us understand what is happening in these two populated areas, and will tell us whether to extend lockdown or perhaps to generalize this load at part. So I think that in line with the WHO's call, what we are doing is very active. We are not just sitting down and locking down, but we are moving ahead to search for all possible cases. We'll bring them out and quarantine those who have to be quarantined, isolate those who have to be isolated. And then I hope that we should be able to have that measure to enable us with this kind of issues of our corporate.
You are now going to identify the cases. You are now going to do the contact tracing. And so if you look at the curve, it's definitely going to come. I won't be surprised if tomorrow they come and they say we have increased. I won't be surprised at all. And I'm expecting that we are going to go up. But the question is, how fast are our numbers rising? Where are the cases coming from? Then we will be able to, if you look at the one in the eastern region, it's an imported case. If you look at the one who traveled from Accra, it's also maybe inland, but we could say it's imported. So can we say that at this point, we are taking our time to test all the contacts, and then from there we will decide whether we should do a nationwide lockdown or not? We are expecting that we'll get the results of the next 15,000 of the contacts that were tested. We have to look at what is the distribution of the new cases. If we think that it is getting into all the regions, then yes, we'll be justified in calling for a nationwide lockdown. Putting everything else in perspective.